This episode of the Oral Health Podcast is brought to you by the Wrigley Oral Healthcare Programme. We'll link all of their information in the description below. Hello and welcome to the Oral Health Podcast. In connection with National Smile Month, we're bringing you bite-sized discussions with different leaders in dentistry on oral health and a variety of topics. Today, we're going to discuss something a little bit different. We're going to look back over the last year and the changes that coronavirus has brought about and the impact that that has had on our oral health. So if we just dive straight in, I've got Dr. Ben Atkins here once again. You'll know him from the last few episodes that we've done. Ben, how are you today?
I'm really well. I've already had my run this morning. Life is good.
Fantastic. I have not had a run this morning. I have gotten out of bed and just sat in front of the TV. So we've had very different mornings, but that's all right.
Oh, no, I've done the TV thing because I've got an 8-year-old and a 10-year-old. So they just need to wake up slowly because they're going to have a big day. They'll do their PE and things at school, but I sneaked out for my warm down run this morning. So yeah, it was good. I'm glad I've done it. I'm feeling on top of the world today.
Well, fantastic. Let's just get straight in then. So to just change the topic slightly, Corona. So all of us over the last year have been through lockdown, various different stages of lockdown, depending on where you are in the country, different levels of restrictions for, well over a year. And at this point, we have become, a little bit desensitized in a sense. This is just the normal now. But a year ago, that was not the case. And lots of people had very drastic impacts that came about very all of a sudden. Oral healthcare isn't immune to that. There has been a lot of delays to service, and people have experienced dental issues and not been able to go to the dentist, and that has caused a lot of stress for people. There's no doubt about that at all. So we're just going to have a chat about the recent changes that have happened to dentistry and the world of oral health, how that's impacted everybody. So, there's quite a lot to unpack there. But when the Oral Health Foundation did the study for National Smile Month, it did come out that dental care has been very, very impacted. Ben, what do you think about that?
I think dental care is the most delayed health service we have in our nation. We're talking about the UK, obviously. It breaks your heart when you delay the wrong patients.
Yeah.
We've got some patients who are dental decay has dramatically improved in the UK over the past 20 or 30 years. It has done. It's something I'm really, really proud of. But we've got segments in society who have got really poor oral health. I've worked in the homeless sector, the hard to reach sector, for the majority of my practicing career, and you realize Dickensian dentistry is still there. So it's those areas of society who are going to suffer the most with any delayed health service. And when you're taking 10 or 15 teeth out of a patient, where do they go for toothaches, that sort of stuff? Your mind starts to wonder. The dental profession is fully open now. If a patient has got a worry about their oral health, contact your practice. It's really, really important to get those habits forming, get the things moving now. Use the situation. For me, I've always reflected the fact that we should be using oral health as something that we can control. Brush your teeth twice a day with a fluoride toothpaste, once before you go to bed and another time during the day. Visiting your dentist as often as we recommend. Speak to your dental practice. Where are you up to? Making sure that you're not missing things. Are you one of those high needs patients? And really focus on our frequency of snacking and sugar intake. Maybe make a diet sheet. Maybe use it with your children. I know it's 2 minutes a day that I can control with my children that I'm focusing on. I know where they are. I don't know what they're doing. So I think I'm one of these people who likes to look for a positive in a situation, because I think as human beings, we need that. I had a bit of a dip personally in January, when I was like, oh, here we go again. I'm struggling with this. And I must admit, oral health was one of those things. I got up in the morning and think, right, I can brush my teeth. I can start with that. Let's go for positivity. And it really helped. It really did.
Yeah, I've got to say, I kind of looked at it similar. It was similar to you. It was probably one of the only things that I could control. I can control
Yeah.
my hygiene habits, and that's about it. Especially, when things first happened in March. I think everyone has had a similar experience where they've just went, oh my God, what is going to happen? For the more high needs people and patients that might have experienced delays, what comes under high needs? When you say high needs, what does that include?
For me, a high needs patient is someone who's got active decay in their mouths. So if need one filling, you're a high needs patient to start off with. There's the ultra high needs who are Dickensian dentistry. But for me, it's getting those patients to understand what they can do to stop that decay.
Mm-hmm.
So that's well, if you reflect back as a patient, if you've not had a filling for 2 or 3 years, your risk is reducing.
Mm-hmm.
You must concentrate on your oral health. You must look at those patterns. You must really focus on prevention. But working with your dental team to say, what's my journey? Am I okay to leave it till the next checkup? Brilliant. Have a conversation. So there's some amazing practices out there who really have worked so well with their patients. They're back under control. There's those that are not, but we've all got different pressures in our lives.
Mm-hmm.
And I get that. And I think as a profession, we've responded really, really well to the pandemic.
Mm-hmm.
And I think it's really important to focus on moving forward.
Yeah.
Not maybe what's going backwards, because we can catch up. We can work with you. If you're worried about your teeth, phone your practice. Practices have been open all the way through our second lockdown,
Mm-hmm.
and we've been there. It's really important to signpost maybe before you have a problem now.
Mm-hmm. Mm-hmm. I know as well, there will be a lot of people who have had their dental appointments, maybe if they had one scheduled in March last year, that was never going to go ahead with the coronavirus. So it's just been rescheduled and pushed back, and maybe have lost contact with the practice, and they're just thinking, when on earth are they going to call me and book this appointment in? So if the dentist hasn't contacted you to rebook, is it safe to say that you're not high needs and they'll contact you when your time's there?
Practices who have been contacting their patients and working with their patients will know if they're a high needs or a low needs patient.
Mm-hmm.
Some of my patients, to be fair, some of my patients I would like to pop round to their houses in the morning and brush their teeth for them if they were that high needs. So you joke that there really were some patients like that.
Yeah.
However, other patients want to come and see the practice. They want that aesthetical clean for stain removal. So we're fully open. And speaking to your practice, if in doubt, drop them a text, drop them an email, speak to your dental practice. They are amazing.
Mm-hmm.
The stories I hear of, even all the way through the pandemic, of one of my, I found one of my dentists cycling around to a patient's house with their prescription just to make sure that they were okay. And there's some lovely stories all the way through there. So as a patient, I always take it's often the patient's responsibility as well to work with dental practice. And I think it's that symbiotic relationship of just give them a phone call. Mm-hmm. The phone call work. We're on Zoom now, you know? And I think we've all got used to this remote chatting. So I've done oral health messaging on Zoom with my patients. So there's a way around things. And the profession has brought really into this digital journey that we do now. And I think patients are responding to that as well.
Yeah, it's definitely become much more normal to just pop on Zoom. And I won't mention brands, but there is like apps where you can do video calls with a doctor rather than going into the doctor's surgery. And like that aspect of healthcare has become much more normal. At least I'm talking from me and my experience. I can just as easily go on Zoom with a doctor as I can going into surgery. But if I wasn't used to video calls, I wouldn't even think twice about having an appointment with a doctor on the phone or a dentist on the phone, because it wasn't like, oh, that feels weird. Now it's so normal that I think, yeah, you're right. People probably are embracing it a little bit more.
It's a double-edged sword, really. I think it's an amazing journey that we could save the health service such a large amount of funding without having to go into the practices and that sort of thing. And also for the patients, the time. If you think about going to the doctors and you think, all right, I've got to block out 3 or 4 hours there to go there, travel, queue, all this sort of fighting.
Delays, yeah.
All that. And you sit there and think, right, the doctor's ready for me. I can crack on with my emails in the background. However, there is that personal touch, and also not continuing working, you know? We've got to think as patients to take that step back and think, what can I use with my time? Can I see my loved ones more? Can I do this? Can I do that? And I think we're a population, it likes to push harder and harder. Sometimes that reflection, the big thing that came out of the first lockdown was that time at home, you know? So looking back with your oral health tips is, are you going to use your time to make sure you brush your teeth twice a day with a fluoride toothpaste? Yes. Brilliant. Set the time aside. Do it. Switch that telly off for 10 minutes. Or use the technology out there to educate your children. My kids are amazing with the apps and all that sort of stuff for oral health. It drives them upstairs to go and do it because they want to go on the electric babysitter, as we call the
good old iPads. Absolutely. It's all about perspective, I think, to a point where we can look at things positively and go, oh, I can have 2 minutes out of my day to do something that is normal and familiar, and really take advantage, make the most of the fact that you can take that time to take care of yourself for a little bit. It's yeah, all about perspective. My background was mental health, so I always look at everything as mindful brushing, mindful this, mindful that. But it's true to a sense, yeah.
It really is, and it's funny how we can use oral health to slow things down. I mean, you know that I keep bees, and that is my mindful health. For I can't rush my bees, so I go and have an hour in the bees, and I'm a different person when I come out, because everything is about being in that moment, being that moment, having 2 minutes with your children to start your day. It's possible, it could be the best 2 minutes you're going to have in the day, you know, and utilize making sure oral health is that first step can be such a beneficial change in a chaotic world that we've had. And the mental health of my children, I think, also giving them stability. Kids like boundaries. Create 2 minutes. It's not much time in the big picture, but it can be such a changing, life-changing moment if you get your oral health perfect, because we've got to look after our teeth for next potentially 100 years.
Yeah, absolutely. I think that's a really lovely note to end on. You know, we've discussed an awful lot. There is a lot that can be unpacked in the discussions we've had, particularly because we have spent this episode focusing around the pandemic and pandemic impact. But we've discussed the importance of that 2 minutes, especially during uncertain times, and changes in dental practices. And don't be afraid to call the dentist. They are open now. If you think you've got a problem, just give them a ring. Just give them a ring. If need be, they'll book you an appointment. If not, they'll give you some advice and send you on your way. And there is a lot more that we probably could discuss, but for the sake of time, we're going to keep it short. But if there is something that you think we've missed, particularly because this is it's a topic that there is a lot that could be discussed. So if you think that we've missed something really important, let us know and we can pick it back up and have another chat about it. Ben, thank you so much for spending some time away from your bees to come and sit and talk to me. And it's been fantastic. And yeah, see you later.
Thanks very much, and keep smiling.